Hi, this is Professor Dr. G.N. Mahapatra, Executive President of the World Congress, 4th edition of the World Congress on Clinical Cardiology and Cardiac Imaging, which is being held in Hotel Lalit, Mumbai from 10th, 11th and 12th of October. About 400 national faculties, delegates, PG students and 40 international speakers. They have all assembled to speak on various topics, to have panel discussion, to have plenary sessions, to have certification course, and etc., and discuss in detail on a common plan which is the best treatment modality for treatment of coronary as well as non-coronary artery disease. I have delivered a lecture here on the role of multifaceted PET scanning in various cardiovascular disorders. As you know, PET, positron emission tomography, has played a major role and it is considered to be the gold standard in the assessment of myocardial viability. What is myocardial viability? When the patient suffered a heart attack, acute myocardial infarction, then some muscles have damaged, and those damaged muscles may be on the ischemic, less blood supply to the heart muscles, or chronic myocardial ischemia, repeated intervention or repeated reduction in the blood supply, that is called chronic myocardial ischemia, and these type of patients, and also the previous attack of acute myocardial infarction. So, to find out whether it has got viability or it has got non-viability or scar myocardium. As you know, the myocardial viability after detecting by PET, positron emission tomography, which is a gold standard, if you say there is a mismatch, means there is a reduced or absent perfusion, but there is a presence of a adequate myocardial viability by injecting F18-FDG, suggests the patient is a suitable case for bypass surgery or angioplasty. But if the patient has got a reduced perfusion, absent blood supply to the heart muscle, as well as no viability in the myocardium, that is called match pattern, that is called infarcted scarred myocardium. So in this patient type of group of patients, they will be managed medically or by cardiac transplantation, because the dead myocardium cannot be recovered even if you put a stent or even if you put a graft. The dead myocardium or fibrous myocardium cannot be recovered. This is one aspect, and this is called the gold standard in the assessment of myocardial viability. Apart from this, there are other non-cardiac diseases like amyloidosis, sarcoidosis, myocarditis, and lead infections, infective endocarditis. F18-FDG PET has got a role. For example, suppose the patient has got heart failure with preserved ejection fraction. The ejection fraction is normal, almost normal, and the heart failure symptoms and signs will be there. So in that particular patient, the patient should be given, will be doing the patient's coronary flow reserve. Even if the blood supply is normal and the coronary flow reserve is less, then we can say that this is called the preserved ejection fraction with this thing. Then we investigate the patient for infiltrative cardiac disease like sarcoidosis and amyloidosis. So sarcoidosis, we find there is a resting perfusion scan where the perfusion scan is normal, or if the muscle is damaged, fibrosed, then it will show a fibrotic myocardium, absent perfusion. But after doing that, and when you will have a FDG labeled F18-FDG in fat, increased fat content and injection of unfractionated heparin, then the patient will have uptake. Then we can say the patient has got active sarcoidosis. If you treat the patients for steroids, tapering dose, and then after 3 months you can repeat, then you can say what is the response to the treatment before and after sarcoidosis involvement. Similarly, amyloidosis, similarly lead infection, similarly. So in majority, the PET scanning has got a multifaceted role in coronary artery disease as well as non-coronary artery disease like myocarditis, like infiltrative cardiac disease, like lead infection, like prosthetic valve infection, like pacemaker infections. All these things can be detected and managed following medical therapy. Thank you all.